I am Dr. Carey. I am a pediatrician in Ventura, California, and we are talking baby care. Today, I'd like to introduce two guests who have joined me to share their child's experience with diarrhea. Yes, you heard me right. We are going to discuss this very unpleasant topic and learn a bit about when one should be concerned for your child. This is Anjali, the mother of Michaela, a happy little 7-month-old, and Janine, the mother of Abigail, who is 23 months old and about to celebrate a birthday really soon. Wonderful. Welcome.
Thank you. Hello.
Hello. Janine, why don't we start with you? Why don't you tell me a little bit about your child's last illness when we had a wonderful bout of diarrhea? What happened?
The diarrhea started and lasted probably about 5 days. It was actually just, all diarrhea for about 5 days. And we were getting a bit concerned, so we had called the doctor, your office, and they had told us that it could last 3 weeks, which was kind of surprising. I didn't know it could last that long. And so they just said, keep her hydrated and make sure there's no blood in the stool, which there wasn't.
How about your child?
In my case, mine was 2 months old, so I think that's scary because she was young. And it started on a Monday, and she had I would say 7 dirty diapers that day. So I call you, and you saw her on Tuesday, and what we did is just that I was breastfeeding every 4 hours, and then I started to feed her every 2.
I think some people are surprised about how long diarrhea can last. First off, the normal stooling cycle for anyone can be anywhere from 7 per day to 1 every 7 days, so the range is huge. Usually for newborns or very young ones, reflexively they want to poop about 20 to 30 minutes after a meal, and considering one is breastfeeding or bottle feeding very frequently, we tend to get a lot of diaper changes in a very short amount of time in children. And then something happens, and I have no idea what it is, but at 6 weeks of age, you can mark it on your calendar, most children start pooping less. So they suddenly it slows down, don't know why, you're sort of happy about it. You might get a little more fussy because of things, but at least you're not changing as many diapers. And then when the diarrhea starts though, and then we end up with a change in the substance, it becomes more loose, more watery, and many more, then we really start to wonder what's going on here. And there certainly are reasons why one should worry. And what was your biggest concern with your child?
Mine was mostly dehydration.
Certainly when taking a look at any child, most pediatricians and physicians are on the lookout for the odd things that can happen, but certainly the number one concern, especially in a 2-month-old, but in anyone, is dehydration, because we lose a lot of fluid during a course of diarrhea. And trying to make sure that they're drinking okay and keeping hydrated is really important. When they're not throwing up and they're taking fluids and we can keep that fluid coming in, that's really much easier. When we have an episode when there's vomiting involved, then you have to really be a little more cautious to make sure that we're not getting dehydrated. I think in really little children, especially when they're just a couple months old, when they're having that much diarrhea, it's really important for them to be seen and assessed, because they can get dehydrated within 6 to 12 hours. The older they get, they can go quite a bit longer, especially if they're drinking fluids pretty well. But trying to get a sense for how their hydration is really important. And Anjali, especially with the very young ones, looking to see whether they are interacting or whether they seem overly sleepy or tired is so important, because at 2 months of age, they just don't have many ways of telling you what's going on. So when they stop acting right, then you really have to keep your antenna up and know whether we need to do a little bit more than just simply keep feeding. Some people have talked about in the past, you change the diet or do something more bland. I tend not to do that. Certainly the milk will cause a little bit more diarrhea, but the lactose in it will. But we're also depriving them of nutrition, and that gut needs to heal, because when we're getting that much diarrhea, what happens is the lining of the gut has pretty much become injured. and it's not absorbing water the way it's supposed to, and everything's coming out pretty fast. And it's important for that gut to heal, and the way that gut heals is to get nutrients. And therefore, if we can try to keep to a regular diet, if we can try to keep to the kinds of things a child wants to eat, things will heal much better. Maybe increasing the frequency of breastfeeding is really a good way of making sure that we're getting enough in. Your child drinks water really well, and we can push that a bit more on top of it. But sticking with as much of a basic diet as we can whenever possible is really a great way of helping resolve things. Now, there are certainly things that make one concerned besides the dehydration, which is a reason to certainly see the physician right away. Blood in the stool is one that makes me wonder what's going on, because a lot of infections present with bloody stools, and sometimes we do things about that, sometimes we don't, but it's important to check them out and see what's going on, and maybe get a culture of the stool and see what's growing in them. The green isn't always a good sign of what's going on. It just means things are going through the gut very fast, and it's very common for babies to have green poops, so you never really know whether it means anything. Some will say, oh, a lot of mucus in the stool is an indication of infection, and it certainly can be, but for every child I've seen who had mucus in the stool from infection, there are plenty of others who have it just for whatever reason, and one never really finds a source. I often ask about travel exposure, because certainly going to other countries, one can possibly pick up something that will cause a lot of diarrhea. And then pets, a lot of unusual pets, lizards, salamanders, turtles. It's not too often that a 2-month-old is playing with a turtle, but certainly pets like that can transmit some diseases that can cause infections. Another thing to consider are medications. Was your child taking any medication to begin with? So we have an active little one who's all over the place, who's getting into things, and then you have to wonder, did we get into something? Did we eat or ingest something? Did we get into a medication? Did we get into something that would have caused some stomach irritation? So it is even more reason why childproofing and making that house safe is so key, isn't it? Some parents wonder whether to bring in a sample of stool for the physician to see. Some physicians will say yes. The gastroenterologist I trained under during residency would call it stool gazing. He liked to. Some would rather not take a look, but it's probably, if there's a lot of blood or something else going on, probably good. When it comes down to it, the take home is that diarrhea can last a little bit longer than people expect. Certainly after a week of diarrhea, of just straight diarrhea, if the child isn't dehydrated, there is no fever, there's nothing else, and you watch it for a number of days. On older children, there's no problem with watching for at least a week. At some point, it's important to touch base with a pediatrician, because they may want to do something about it, and little ones should be seen right away. Again, I thank my guests for sharing their experience with us. I'm Dr. Carey, and I thank you for watching. For more baby care education and to sign up for our free newsletter, please go to drcareys.com, where at Dr. Carey's, we teach baby care. Thank you.
Thank you.
Breathe in, breathe out. Breathe in, breathe out. Okay. Let me see your ears.